has been a waiting game for people who received the one-dose Johnson & Johnson vaccine over whether or not a booster would soon become available.
The company said today they're working on it. News 8's Dana Marie McNichol is at County COVID-19 testing site with more on the latest announcement.
We've now heard from all three major vaccine providers that a booster shot is on the way. Johnson & Johnson says 2 is better than 1, and it comes with further protection.
People who received the single dose of the Johnson & Johnson COVID-19 vaccine could be lining up for a second very soon. Better protection against the virus for a longer period of time. That's what the company says after releasing data on its latest trial.
It was all great because we thought we're going to get one shot to fix it all, right? But it turns out that maybe our immune system needs another look.
Dr. Smith is head of infectious diseases and global public health at UCSD. He says the booster shot is the same shot given again.
Nothing new or special about it. It's just that it's another time to teach the immune system how to do something to prevent people from getting COVID-19. The good news is it works great. The bad news is it probably means another shot for people who got the J&J vaccine the first time.
Johnson & Johnson announced that its single-shot vaccine is 66% effective in preventing moderate COVID-19. The new study found if a booster is given 2 months after receiving the initial vaccine, effectiveness jumps to 94%.
What we're understanding now is that to really build a good immune response, we need to tell the immune system more than once about the virus. So this second dose of J&J is just giving another study time for our immune system to really fight the virus.
And when it comes to who gets the booster, he says it depends on who his patients are.
For people who are immunosuppressed and over the age of 65, yes, we will be very much encouraging those people to get their boosters.
But for younger patients with strong immune systems, Dr. Smith says to look at the data to decide if a booster is the right choice. Last week, the FDA recommended against approval of the booster dose of the Pfizer COVID-19 vaccine unless you were immunocompromised. That ruling did not include the Johnson & Johnson booster shot.
The company is taking the next step and says it's in talks with the FDA and other regulators about using the booster dose of the vaccine.